Dear friends, welcome to my Geriatric Medicine channel. I am Dr. C.J. Keshavamurthy from Shivamogga. I am a geriatrician practicing here. Today we shall discuss about depression. So depression is so common in elderly people. Why? Why it is so common in elderly people? Depression is one of the most common psychiatric disorders among elderly. It is more common in the elderly because depression is mainly interrelated with the medical and the social problems. So, in geriatric patients, depression, we encounter it very frequently and we'll have to treat it accordingly. What are the common causes or risk factors for the development of depression? Friends, any chronic medical painful condition can cause depression. For example, the cancer, which is, though it is treatable, many times it is very difficult to cure. It causes a lot of pain, lot of what is that called, treatment procedures, and so causes depression also. Then the heart attack and the heart failure. If the patient undergoes an episode of heart attack, he often recollects the episode and gets depressed. Then the hypothyroidism, the Parkinson's disease, the Alzheimer's disease, these are the diseases of the brain. Then comes the malnutrition, HIV infection, alcohol, drugs, for example, the antihypertensive drugs, may cause depression in elderly patients. Any social factor responsible for depression? Yes. Loneliness. Many times the elderly couple, one of them will die, and the loss of spouse results in loneliness and isolation. Loss of spouse or partner, dependency, and decreased social support will cause depression. Persons with low income are at greater risk for depression. Those with adequate financial support or earnings will somehow cope up with the situation, but persons with low income will often suffer from depression. Depression is one of the most common risk factors for suicide also. Is there any other factor which causes risk factor, which becomes a risk factor for suicide in elderly patients? Yes, male sex, painful and disabling physical illness, solitary living situation, loneliness, debt and poverty. All these causes a intention to die, and that is suicide. Bereavement, history of drug or alcohol abuse, history of a prior suicide attempts also causes one to commit suicide. What's the response to the treatment? Outcome of depression follows the rule of thirds. 1/3 of elderly patients get better and stay better, and 1/3 get better but relapses will be there, and 1/3 do not improve at all or improve only marginally. With time, however, most elderly patients who experience major depression in late life, recover. Prognosis is worse when depression is complicated by underlying medical disorders. So, friends, this is about the depression in a nutshell in elderly patients. And dear friends, you please go through this episode of which explains about depression, like it, subscribe it, and share it with your friends. Thank you. I am Keshwamurthy. जय भारत, जय कर्नाटक.